Veterinary Medicine Digital.
There's been some important improvements in treatment over the last 3 to 5 years. One of these is the advent of early feeding. And the idea behind early feeding is to protect developing enterocytes after they've been affected or are growing back after being affected by the virus. To initiate early feeding, you need to prevent vomiting in the patient, and this can be difficult to control. But with the use of various drugs such as metoclopramide and the serotonin inhibitors or antagonists, you should be able to induce some degree of vomition control early in these patients. Then, by placing a nasogastric tube, you can give a slow drip feed, and you can use enterolite in this modality, or even PD that has been homogenized and strained through a baby strainer so that it doesn't clog the tube. Don't place surgical feeding tubes such as a PEG tube or an esophageal tube. Because these dogs will have severe immunocompromisation from low white cell counts. So with the placement of a nasogastric tube, even within the first 2 to 3 days of receiving a parvo puppy, these dogs will recover quickly, or more quickly than without early feeding, and also their morbidity will improve over the recovery period. It also seems to improve their albumin levels later on in the course of parvovirus. And albumin levels can be a problem in the later part of the course of the disease because of the severe loss of albumin through the feces. So early feeding through a well-placed and a nicely placed nasogastric tube is definitely something that I advocate for parvo cases, as long as you can control emesis. The other area that perhaps we need to consider more closely and be more diligent in controlling is pain medication for these puppies. This is often dependent on risk analysis and also cost analysis with clients. It's not necessarily cost effective to put a continuous rate infusion pump on some of these animals that you have in an isolation facility and you can't monitor very well. But in our experience, the best pain regulation for these cases is using a constant rate infusion of low-dose ketamine. And ketamine can be given without any central nervous system suppression at doses from about 5 micrograms per kilogram per hour. This can be given for about 6 to 8 hours and then reduce the dose down to 2 to 3 micrograms. This provides enough pain suppression often that when you have those puppies that are difficult to control emesis, this will help the actual emesis control and also make that frequent abdominal palpation, which you should be doing during your normal monitoring of these cases, a lot easier on the patient.